Hi there, and welcome to Canceling COVID. I'm Tonya Rivens. We come with you to share information about this relentless attack on our community, that thing called COVID. We're still at it, and we want to help you protect your family and, of course, your community as we continue to talk about this issue that's impacting our community in so many ways. I want to say thank you to our sponsors, Mecklenburg County Public Health. You can go to mecnc.gov. That's mecnc.gov if you need additional information. In addition to that, you can call 980-314-9400, 980-314-9400 if you have any questions. Also, thank you to Groundwater Solutions, Dr. Tracia Black and the entire group over there working so hard in the community. Genesis Project is also a part of that organization, and they continuously work in the community. Well, one of the biggest things to happen this past week is, of course, the vaccine is now available for children ages 5 and older. They are able and eligible to get the vaccine. And that is really another game changer as we continue to deal with the pandemic. According to the CDC, the vaccinations will protect 28 million more American children from what's become one of the 10 leading causes of death in children in the U.S. And that's pretty big because, to lose lives is such a tough, difficult thing. We've lost more than 700,000. And now it looks like the attack apparently is on our young people, our future. So elementary kids started to get the Pfizer in Charlotte as early as Wednesday. I know StarMed was allowing people to sign up. And when I was talking to them last, they had as many as 2,000 who had already pre-registered. And it comes at a time where pediatric virus rates are increasing in Mecklenburg County, and children younger than 18 made up 27% of COVID cases between October 14th and the 27th. So a short time span there, and 27% of the COVID cases, that's quite a spike. So what we've done today is a little different, but certainly very informative. It's a Q&A. Someone here to answer the questions you may have to address any of your concerns over the pediatric COVID-19 vaccine. And I see as you're starting to hop on, please share this, because this is a conversation with one of the most distinguished and most knowledgeable professionals in the business. It's Dr. Amina Ahmed, and she's a pediatric infectious disease expert and an epidemiologist. So she's very well qualified, very much aware of what it is. And she's a part of Atrium Health's Levine Children's Hospital. So she's going to share a whole lot of information, vital information that you can use and share as well. So as you hop on, please share this so more people can get this information out. So now, Dr. Amina Ahmed taking questions and answers.
Thank you all again so much for joining us this morning. We are joined by Dr. Amina Ahmed. She is our pediatric infectious disease expert and epidemiologist at Atrium Health Levine Children's. And she's here to answer some questions that you all have.
This is a media
approval from the CDC
session that was held that allowed people to ask questions.
Recommending the Pfizer vaccine for 5 to 11-year-olds, and with the news that the Department of Health and Human Services is also fully approved. So we are in an exciting time where we now have vaccines eligible for this new age group. So I will turn it over to Dr. Ahmed just to give a brief overview of what does this mean and what to expect and why this is an exciting milestone. And then we'll open it up to questions from the media.
Great. Thank you. You can hear me? Yep, great. So first of all, as Savannah said, this is amazingly exciting. I can't believe that we're here already. So December of 2020 is when we started vaccinating healthcare workers and the elderly, and now we're before December 2021, we're already vaccinating children down to age 5, which is an amazing amount of progress that we've made. As I've said before, children continue to play a big part in the COVID pandemic. As we've seen over the last year, we've identified that children actually do account for a large proportion of the cases overall, and children being tested, a substantial portion are testing positive, whether they're symptomatic or they're exposed and asymptomatic, they're still testing positive. So at this point, we do know that children make up about 20 to 25% of cases in the last month, especially with the Delta surge. That's a huge proportion considering that children under 18 make up 20 to 25% of the US population overall. So to bring this vaccine to children down to 5 to 11 years of age is just an amazing accomplishment. And And the reason that we're excited about it is, number one, is that, again, children play a big role in the COVID pandemic. So vaccinating children will prevent infections in them, will prevent hospitalizations, will prevent MISC, the multi-system inflammatory syndrome in children, which occurs mostly in this 5 to 11-year-old age group. And then more importantly, also, it will stop the spread of the virus. So we have learned through the pandemic that not only do children play a big role, but they're actually silent spreaders as opposed to the super spreaders. A large proportion of children, especially in this age group, are asymptomatic. So they're asymptomatic, and they're the youngest group that they can't take care of themselves. They need people around constantly. So you're not going to be able to isolate from the 5 or 6 or 7-year-old. And so then they account for a lot of the spread in households of COVID-19, even though they may be asymptomatic or mildly symptomatic. So for those reasons, we're excited to be able to vaccinate this population and prevent further spread of COVID-19.
Great overview, Dr. Ahmed. Thank you. We do have a couple of questions, so we'll turn it over to the media. Claire with WFAE.
Hi, thanks for doing this. I just wanted to check, Dr. Ahmed, to see what you would tell parents who say kids don't get very sick from COVID. Why should I get my child vaccinated?
So we are very thankful in pediatrics. We were very thankful at the beginning of the pandemic and continue to be that children don't get extremely sick. However, we do know that children can get sick, and the most severe manifestation in children, at least, seems to be this multi-system inflammatory syndrome in children. And then the other severe manifestation is in the adolescents. So the 12 to 17-year-olds get very sick. They're just basically like adults. So they're at high risk for getting ill, ending up in the intensive care unit. So I want to point out, even though hospitalizations are not common for pediatric patients, they do occur, and 30% of those hospitalizations, 30% of those children end up in the intensive care unit. I also want to point out that although multi-system inflammatory syndrome in children is not common, it does impact about 1 in every 1,000 to 1 in every 2,000 children that gets COVID-19. And we know that just because we know there's 6 million cases of COVID-19 and about 5,000 cases of MISC that have been reported in the US. So that's sort of the ratio that we're expecting. So that means children can in fact get multi-system inflammatory syndrome in children. Those children largely end up in the intensive care unit, and a substantial portion of them, 50%, are going to end up with some cardiac or heart issue related to this multi-system inflammatory syndrome. Again, fortunately, most recover, but that's with a lot of intervention. So you don't want your child to be one of those that ends up with multi-system inflammatory syndrome in children. And yes, children are mildly ill, but they can be severe illness, so we want to prevent that. And then further than that, children are mildly ill, asymptomatic, but can spread the infection. So they'll continue to be responsible for the spread of infection to adults, to the immunocompromised, to the elderly. And to be able to break this cycle and end this pandemic, we really have to get up to close to 70% vaccination or immunity at the same time. And we're not going to be able to accomplish that without vaccinating children.
Thank you, Dr. Ahmed. We have another question from Chloe with WCNC.
Hi, thank you so much. Just wondering, when is Atrium Health going to start these vaccinations? How can parents make appointments? Where should they expect to go for these types of appointments? Thank you.
Yes, that's a great question. And we, because of the emergency use authorization that occurred last Friday, shipments of vaccine were sent out to various health departments, and from there to local health departments.